Hello everyone, my name is Olamipo and this is my presentation on community health promotion. I live in Maryland, Hanover, Maryland, but I work in Pasadena, Maryland, and so Pasadena is going to be my community of focus for this project. Pasadena is located in Anne Arundel County. So there are a lot of for-profit healthcare centers in Pasadena. However, there is no community clinic or health center located in Pasadena, but there are some in the surrounding areas. Some free and low-income based clinics near Pasadena are House of Hope Medical, People's Community Health Center, Brooklyn Family Health Center, Shanahan Children's Clinic, Family Health Centers of Baltimore, Pioneer City Family Health Center, Baltimore Medical Systems at Annapolis Road, AAMC Community Health Center, and Friendship Academy School Clinic. Now, most of these operate on a sliding scale based on your income. So to be seen at one of these clinics, the patient would have to bring some income documents to show proof of income, and then depending on their income level, a price will be attached for whatever visit that they're there for. However, it's only House of Hope Medical that's a free clinic. They don't require any income documents. You just, come there and you can be seen. So let's take a little bit closer look at House of Hope. It's located in Glen Burnie, Maryland. It's the first freestanding medical clinic in Anne Arundel County. It was opened in the fall of 2011, and it is not affiliated with any hospital or healthcare system. It's kind of on its own. It's staffed by volunteer physicians and other healthcare professionals in the community, and it offers healthcare services to uninsured and underinsured individuals. Just like other clinics, they are open Monday through Friday, 9 a.m. to 5 p.m. And actually, every other Tuesday, they stay later till 7 p.m. to accommodate people who, for whatever reason, couldn't come between the normal hours. Maybe they work late or they have children or whatever the case might be. Some services they offer are primary care, pain management, mental health, and wellness screening. So local public health services, there are some services offered on the state level, some services offered on the county level, and there really isn't anything offered on the city level, as the city is relying on the county and the state to offer services. So on the state level, the state of Maryland, the Department of Health offers services for infectious diseases, cancer and chronic diseases, maternal and child health, environmental health as well. Services include smoking cessation programs, WIC, which stands for Women, Infant, and Children Under 5 years old, family planning and reproductive health, safe water, and food programs as well. I thought it was interesting when I was doing my research that in 2017, Maryland WIC served over 135,000 women, infants, and children each month. Over 135,000 each month. I think this is pretty remarkable, and it tells me that this is a service that is highly utilized and very beneficial to many individuals. So I thought that was really impressive. On the county level, Anne Arundel County offers breast and cervical cancer prevention and screening, colorectal cancer prevention and screening, family planning and sexual health activities, services, healthy eating, heart disease prevention, HIV services, um, infant health and care, mental health, substance use, tobacco use prevention as well. So I think it's interesting and it's good that there are some services that are not offered on the state level that are offered on the county level, and some services that are offered both on the county and the state level. So that way there's multiple resources that a person can utilize to get the same information, which is very helpful. When it comes to vaccines, children 6 months and older without insurance can get a free flu vaccine at the Anne Arundel County Department of Health simply by making an appointment. Really, anyone 6 months and older can get a free flu vaccine. All they have to do is make an appointment. With insurance, children can get their flu shots at their pediatrician's office, at a pharmacy, depending on the pharmacy policy at CVS. Children above 9 years old can get their flu vaccine there. Retail health clinics like Mini Clinic, for example, and urgent care centers also offer flu vaccines to people with insurance. Now, the insurance companies pay for the flu vaccine 100%, so there's no cost sharing to the patient. Children entering kindergarten must be up to date on certain vaccinations before they can start school. These vaccines include DTaP, polio, MMR, hepatitis B, and varicella. For the 2017-2018 school year, Anne Arundel County had a 99% rate for immunizations for their students. The state of Maryland had between a 98 and 99% vaccination rate, and there were two counties in Maryland that had a 100% vaccination rate, which were Somerset and Talbot counties. And most of the other counties had between a 97% and a 99% vaccination rate. So Anne Arundel County was not doing bad at all. When it comes to disaster planning, the Anne Arundel County website has a section for emergency preparedness, and this page has a lot of information about what to do during tragedy situations. They have information on things like flood, storm, earthquake, tornado, etc. The website is in English, but with a click of a button, the same information is presented in Spanish, which I think was very good. The website emphasizes the importance of preparing before an emergency, what to do during the emergency, and also what to do after the emergency is over. They also offer classes as well. So when it came to health education and promotion, I didn't really find any billboards or flyers or anything like that, but I went to my local CVS and I saw some information. There was a poster about the flu shot, a flyer about smoking cessation, and especially in this cough and flu season, a flyer about covering your mouth when you cough. There is also information about the influenza virus, which is on the rise right now, as well as the coronavirus, and just some things to look out for. So like I mentioned, unfortunately, I didn't find any flyers or billboards that had a call to action necessarily. But the Anne Arundel County, I thought, had a lot of information, very, very helpful information that can be used, as well as the Maryland State Department of Health as well. So I was very impressed that there were a lot of services that were provided both on the state level and on the county level, and most of these services are free. However, my only concern will be about the quality of the programs offered and making sure they're up to a certain standard. So it's one thing to offer a lot of services, but making sure that they're quality and they're really impacting the patient. Thank you so much for listening.